Introduction. This chapter deals mainly with structures which connect the upper limb with the back of the trunk. Surface landmarks 1. The scapula, shoulder blade, is placed on the posterolateral aspect of the upper part of the thorax. It extends from the 2nd to the 7th ribs. Although it is thickly covered by muscles, most of its outline can be felt in the living subject. The acromion lies at the top of the shoulder. The crest o/the spine of the scapula runs from the acromion medially and slightly downwards to the medial border of the scapula. The medial border and the inferior angle of the scapula can also be palpated, Fig 5.1. 2. The 8th rib is just below the inferior angle of the scapula. 3. The lower ribs can be identified on the back by counting down from the 8th rib. 4. The iliac crest is a curved bony ridge lying below the waist. The anterior end of the crest is the anterior superior iliac spine. The posterior superior iliac spine is felt in a shallow dimple above the buttock, about 5 cm from the median plane. 5. The sacrum lies between the right and left dimples mentioned above. Usually 3 sacral spines are palpable in the median plane. 6. The coccyx lies between the 2 buttocks in the median plane. 7. The spine of the 7th cervical vertebra or vertebra prominens is readily felt at the root of the neck. Higher up on the back of the neck, the 2nd cervical spine can be felt about 5 cm below the external occipital protuberance. Other spines that can be recognized are T3 at the level of root of the spine of the scapula, L4 at the level of the highest point of the iliac crest, and S2 at the level of the posterior superior iliac spine. 8. The junction of the back of the head with that of the neck is indicated by the external occipital protuberance and the superior nuchal lines. The external occipital protuberance is a bony projection felt in the median plane on the back of the head at the upper end of the nuchal furrow, running vertically on the back of the neck. The superior NOC/to/ lines are indistinct curved ridges which extend on either side from the protuberance to the mastoid process. The nuchal furrow extends to the external occipital protuberance, above, and to the spine of C7 below. Dissection. Identify the external occipital protuberance, I, of the skull. Draw a line in the midline from the protuberance to the spine of the last thoracic, T12, vertebra. 2. Make incision along this line, Fig 5.1. Extend the incision from its lower end to the deltoid tuberosity. 3. On the humerus which is present on lateral surface about the middle of the arm. Note that the arm is placed by the side of the trunk. Make another incision along a horizontal line from 7th cervical spine, 4, to the acromion process of scapula, V. Reflect the skin flap laterally. Position. Man mostly lies on his back. Therefore, the skin and fasciae of the back are adapted to sustain pressure of the body weight. Accordingly, the skin is thick and fixed to the underlying fasciae. The superficial fascia containing variable amount of fat is thick and strong and is connected to overlying skin by connective tissue, and the deep fascia is dense in texture. Cutaneous nerves. The cutaneous nerves of the back are derived from the posterior primary rami of the spinal nerves. Their distribution extends up to the posterior axillary lines. The following points may be noted. L. The posterior primary rami of the spinal nerve CL, C7, C8, L4 and L5 do not give off any cutaneous branches. All 12 thoracic, L1, L3 and 5 sacral nerves, however, give cutaneous branches, Figs 5.2 and 5.3. Each posterior primary ramus divides into medial and lateral branches, both of which supply the erector spinae muscles, but only one of them, either medial or lateral, continues to become the cutaneous nerves. In the upper half of the body, up to T6, the medial branches, and in the lower half of the body, below T6, the lateral branches, of the posterior primary rami provide the cutaneous branches. Each cutaneous nerve divides into a smaller medial and a larger lateral branch before supplying the skin. 3. The posterior primary rami supply the intrinsic muscles of the back and the skin covering them. The cutaneous distribution extends further laterally than the extensor muscles. For no posterior primary ramus ever supplies skin or muscles of a limb. The cutaneous branches of the posterior primary rami of nerves L1, L2, L3, and S1, S3 are exceptions in this respect. They turn downwards unlike any other nerve and supply the skin of the gluteal region. Dissection. Muscles connecting the upper limb with the vertebrae column identify the attachments of trapezius muscle in the upper part of back, and that of latissimus dorsi in the lower part. Cut vertically through trapezius 5 cm lateral to the vertebral spines. Divide the muscle horizontally between the clavicle and spine of scapula, and reflect it laterally to identify the accessory nerve and its accompanying blood vessels, the superficial cervical artery and vein. Look for the suprascapular vessels and nerve deep to trapezius muscle, towards the scapular notch. Cut through levator scapulae muscle midway between its two attachments and clean the dorsal scapular nerve, supplying the rhomboids, and accompanying blood vessels. Identify rhomboid minor from rhomboid major muscle. Pull the medial or inner scapular border away from the chest wall for looking at the serratus anterior muscle. Define attachments of latissimus dorsi muscle. Features. Muscles connecting the upper limb with the vertebral column are the trapezius, Fig 5.4, the latissimus dorsi, the levator scapulae, and the rhomboid minor and rhomboid major. The attachments of these muscles are given in Table 5.1, and their nerve supply and actions shown in Table 5.2. Additional features of muscles of the back. Developmentally, the trapezius is related to the sternocleidomastoid. Both of them develop from bronchial arch mesoderm and are supplied by the spinal accessory nerve. The principal action of the trapezius is to rotate the scapula during abduction of the arm beyond 90. Clinically, the muscle is tested by asking the patient to shrug his shoulder against resistance, Fig 5.5. Structures lies under cover of the trapezius. A large number of structures lies immediately under cover of the trapezius. They are shown in Figs 5.6 to 5.8 and are listed below. A. Muscles. L. Semispinalis capitis. 2. Splenius capitis. 3. Levator scapulae, Fig 5.6. 4. Inferior belly of omohyoid. 5. Rhomboid minor. Rhomboid major. Supraspinatus. Infraspinatus. Latissimus dorsi. Serratus posterior superior. A. Suprascapular artery and vein. A. Vessels. 1. Superficial branch of the transverse cervical artery, superficial cervical, and accompanying veins. 2. Deep branch of transverse cervical artery, dorsal scapular, and accompanying veins. Nerve. 1. Spinal root of accessory nerve. 3. Suprascapular nerve. 4. C3, C4 nerves. 5. Posterior primary rami of C2, C6 and T1, T12. Pierce bursa. A bursa lies over the smooth triangular area at the root latissimus dorsi. 1. This is the only muscle which connects the pelvic girdle and vertebral column to upper limb. It possesses extensive origin and narrow insertion. 2. The latissimus dorsi develops in the extensor compartment of the limb. Thereafter, it migrates to its wide attachment on the trunk, taking its nerve supply, thoracodorsal nerve, along with it, lata equals wide. 2. The latissimus dorsi is tested clinically by feeling the contracting muscle in the posterior fold of the axilla after asking the patient to cough. Triangle of auscultation. Triangle of auscultation is a small triangular interval bounded medially by the lateral border of the trapezius, laterally by the medial border of the scapula, and inferiorly by the upper border of the latissimus dorsi. The floor of the triangle is formed by the 6th and 7th rib, and 6th intercostal space, ICS, and the rhomboid major. This is the only part of the back which is not covered by big muscles. Respiratory sounds of apex of lower lobe heard through a stethoscope are better heard over this triangle on each side. On the left side, the cardiac orifice of the stomach lies deep to the triangle, and in days before X-rays were discovered the sounds of swallowed liquids were auscultated over this triangle to confirm the esophageal tumor, Fig 5.4. Lumbar triangle of Petit. Lumbar triangle of Petit is another small triangle surrounded by muscles. It is bounded medially by the lateral border of the latissimus dorsi, laterally by the posterior border of the external oblique muscle of the abdomen, and inferiorly by the iliac crest, which forms the base. The occasional hernia at this site is called lumbar hernia, Fig 5.6. After completing the dissection of the back, the limb with clavicle and scapula is detached from the trunk. Trapezius is a shrugging muscle supplied by spinal root of 11 nerve. Trapezius with serratus anterior causes 90°-180° of abduction at shoulder joints.